So we'll have, I guess, John, we'll start off with the 5-minute presentation. Please briefly introduce yourself and go into your time, and then we'll have a tool speak, similarly to quickly introduce yourself in your presentation, and then we'll have a series of questions and a discussion.
Do you have a clicker, or we just say next slide?
You see, I have a couple of animations, so it'll be easier to.
Should we, so people see if we're sitting together?
Sure. So I'd like to thank the committee and the Institute for the chance to be here. I'm going to go fairly quickly, and I'm going to focus on what open means, because I think the tool is going to talk about why to go open. But what I want to mainly point out is that there is going to be a fairly constant tension between community definitions of open data and the realities of sharing clinical data as a result of privacy. And so it's a word that has meaning outside of this space that's not always necessarily recognized or known. So since 2006 or so, the free culture community has been working in the free software communities with open science. Artie and I were a part of this in a different organization. And there's a long-standing community definition of openness, which is reflected in the report that was put out for draft comment, which is anyone can access. The asterisk on there is simply to note that that can be subject to a small set of conditions. So things like do no harm, do not attempt to re-identify are compatible terms with this anyone can access. But the idea is you cannot restrict access to someone based on whether or not they're an academic, whether or not they have credentials like a PhD, right? It is an open access application, and no one will be rejected because they don't have the right credentials or because they work in a company. That's very, very important. The right to commercially use something without additional permissions is an essential part of compliance with these community definitions. Also very important are the rights to reuse without asking extensive permissions. So this is why things where you have to ask for permission to study a data set only in the context of one disease fail open definitions, because you need to be able to use them in a myriad number of ways without going back for additional permissions. And also importantly, the right to redistribute data is a key part to complying with any open definitions. There's a small conditionality here, which is it's possible in some spaces to comply with open definitions and say you can only redistribute to other people who've signed the same open deal that you have signed. Right, so there's some cases in which a contractual privity can exist that allows for redistribution, but any restrictions on saying you can't give this to people even if they've signed the same open contract, you can't use this for commercial purposes, those fail every single one of the definitions of freedom and openness that the community has come to. So these words have meaning outside the space that is important to pay attention to. So here are 4 examples of some open genomics projects. This is SNPpedia, the Personal Genome Project, OpenSNP, and from where my organization, Sage Bionetworks, Portable Legal Consent. In each of these 4 cases, access to the data does not require registration beyond signing a simple data use agreement that says, I'm a human, I agree not to identify, and I agree not to harm. In each of these 4 cases, there's very little enforcement contemplated. It depends on which of the projects. At Sage we do, and at PGP we do, at the other 2 no. And so obviously if you're going to make data available for reuse, redistribution, and anyone can access it, it has very important consequences for study design, informed consent, de-identification, the place where the research happens on the data, which is what I call compute space, and the distribution use agreements. And so if all 5 of these are not taken into account at the beginning of the study, it's often going to be very hard to make the study available under true open access definitions and systems. It's plausible with some kinds of studies that you can pull this off, but in general, if you're going to go open access with a clinical study, you need to start at the beginning of the study by thinking about it as an open access study and consent people properly for it. So we think of things at Sage as sort of it's a 4-track process to make something open. You have to collect the data, de-identify it, syndicate it to an environment, and then research happens on top of it. If you're dealing with genetic information, it has a high identification percentage, and the de-identification tools are weak. They make the data less useful because they salt or add noise to it. The stuff that's coming out of your clinical records, your meds and so forth, right, that's a high ID, but we have strong de-identification tools. So it's easier to syndicate medical records, right, than it is to syndicate genomes in an open access way. The sort of omics data that comes out is actually a fairly low identification percentage. That is probably going to change over time, but at the moment, because you have a low identification possibility, it's relatively easy to syndicate this data in an open access way. And then sensor data, right, which could be mobile phone, it could be fitness trackers, it could be any number of patient-reported systems. High identification percentage, depending on the way you design the study. But there are also strong de-identification tools available. And the main point to make out is if you're going to do an open access study, it really does require not just putting the clinicians in the middle, but putting the participants into the middle. Because it's really, really hard to truly make these sorts of individual level records available under open access definitions if you don't engage the patients from the very beginning in that openness. The risks of re-identification are simply too high to pull it off. It doesn't make any of the controlled access schemes bad. It just means that you need to watch the phrasing in terms of how you distribute the data. I'll stop there.